everyone. My name is Anagha Thiagarajan, and I am a medical student at UC Irvine. I hope you guys are all enjoying your lunch as I give this talk. But our study is on concomitant skin conditions and comorbidities in Black and African American patients with rosacea. So just a little bit of background, rosacea is a chronic inflammatory skin condition characterized by erythema, papules, pustules, and telangiectasias. And the problem that we want to address is specifically in skin of color patients. Rosacea is underdiagnosed in skin of color patients, and even when skin of color patients come in with the same complaints as non-skin of color patients, they are misdiagnosed or underdiagnosed. As you can see in this table here, the average age of diagnosis for rosacea is about 36 years old. But when that's adjusted for Black and African American individuals or skin of color patients, it's almost 11 years or higher than that. So it's about 47 to 51 years old. So why does this matter? Skin of color is under-researched in dermatology. A survey study found that about 47% of dermatologists and dermatology residents indicated that they felt their training was inadequate to diagnose skin of color skin diseases. So this is important because underdiagnosis or delay of diagnosis can lead to downstream consequences for a variety of reasons. But in recent years, there have been some diagnostic criteria published. So you can see that on the right here. And then another important aspect of this study that inspired this study is that rosacea is associated with various comorbidities. So you can see here on this chart that there's a lot of factors that can contribute to comorbidity development, such as chronic inflammation, genetic factors, psychological stress, there's smoking status, which would fall under also environmental factors and lifestyle habits. But notably, some of these comorbidities are migraine, anxiety and depression, cardiovascular disease, a variety of GI diseases such as celiac, Crohn's, ulcerative colitis, as well as metabolic disorders such as type 1 diabetes or type 2 diabetes and autoimmune disorders as well. So the purpose of this study was to determine among the patients that are diagnosed with rosacea to determine the difference in the prevalence of comorbidities in Black and African American populations versus non-Black and African American populations. And so we did this with a database called TriNetX that is a large nationwide database using de-identified patient data. We selected patients from 2005 and 2025 with an initial diagnosis of rosacea and used risk ratios to characterize the likelihood of being diagnosed with a cutaneous condition or comorbidity after this initial diagnosis of rosacea. And we compared the outcomes of Black and African American patients to non-Black and African American patients. And we propensity matched them to control for confounding factors such as age, sex, as well as a BMI over 30. And these are our results. To sum up, this is not an exhaustive list of all the conditions that we analyzed, but as you can see here, there is a variety of comorbidities that Black and African American populations are more at risk to be diagnosed with after an initial diagnosis of rosacea. And as well, there are also rosacea-related sequelae that you can be diagnosed with after the initial diagnosis of rosacea that you can see here. So some of the limitations of this study were that a lot of patients have confounding factors, so a previous diagnosis of lupus or rheumatoid arthritis that might cause these patients to be on corticosteroids for a prolonged amount of time could lead to the development of rosacea and in turn lead to chronic inflammation and the development of comorbidities. We also looked into glaucoma, so we found that Black and African American patients with rosacea are at higher risk to be diagnosed with glaucoma after an initial diagnosis compared to the non-Black and African American population. So this is another thing to look into a little bit further because it's known that corticosteroid or prolonged corticosteroid use can also lead to the development of glaucoma. So controlling for that in future studies would definitely be a good future direction. And yeah, that is what our study was about. We found that Black and African American patients are at increased risk to develop various comorbidities and rosacea-related sequelae compared to non-Black and African American patients. We suggest that in clinical practice, maybe it might be a great idea to screen patients for comorbidities at a diagnosis of rosacea so that we can understand if these are comorbidities that already existed before their diagnosis, but just were only diagnosed after rosacea. So this is another limitation of the database of TriNetX, because we can't look into the specific charts of every single patient to see what their comorbidities might have been. But yeah, we're also looking into mechanisms related to prolonged inflammation are very important to understand further why comorbidities might be developing and looking into this pathogenesis. So this is our wonderful team. On the bottom right here, we have Dr. Mesenkovska, the PI for this study, and our research fellow, Millen, and our wonderful team of MS1s.